Hello, everyone. I am Dr. Viraj Sanghi, Senior Pediatric Neurologist and Consultant at SRCC Children's Hospital, managed by Narayana Health. I'm here today to talk to you about autism spectrum disorder and what this means for you as a patient or a caregiver or a family member of a child with autism. So, one of the things we must keep in mind is that autism is a fairly common neurological disorder. It occurs in about 1 in 64 children. So it is as common as that. It is more common than all cancers combined. Now, many parents ask me, what is autism? Autism spectrum disorder is a condition in which we have an impairment of the development of language, communication, social skills, and often associated with repetitive thought or repetitive behaviors. Detection of autism at an early age is very important. We have a lot of therapies that can help children with autism, and families can get a lot of benefit by seeking help early. In order to accomplish this, it's important for you as a caregiver or as a teacher in a school or a family member to recognize some of the early symptoms and signs of autism. Autism is often characterized in the early stages by delayed language. One of the earliest signs that we see is an infant who doesn't start pointing on time. Using a point to point out objects of interest is very important, and we often see that infants don't point. They don't often make eye contact with their family members and caregivers. Language is often delayed. We typically expect to see meaningful words develop by the age of 12 to 16 months. And we often find that children with autism have delayed language where meaningful speech doesn't often occur till even 2, 3, 4 years, or sometimes even later in severe cases. So these would be important signs to look for. If your infant is not pointing, making eye contact, or has delayed language, it is important to seek out the help of a specialist, either a developmental pediatrician or a pediatric neurologist like myself. The initial assessment would be a clinical observation and detailed history taken from the family member or the caregiver. This may be followed by a series of tests that your healthcare provider may ask for. Tests may include scans of the brain. They may include blood tests to look for genetic problems and other tests such as a hearing test to make sure that your infant's hearing is normal. Autism is considered to be a genetic disorder. There has been a lot of research worldwide, and we now know that there are several genes, not one, but several genes that are responsible for producing autism in children. Much research is being done on finding a cure for autism, but as yet, we don't have a specific genetic cure. Treatment focuses on therapy. This therapy would include behavior therapy, such as applied behavior analysis, speech and language therapy, occupational therapy, and of course, um, cognitive therapy, education therapy. These would be the cornerstone of treatment and are very, very important for children with autism. These therapies must be provided on a regular basis and often are needed for years. Your healthcare provider may also want to start drug management for certain behaviors, anxiety, aggression, severe repetitive behaviors. These may warrant some pharmacological therapy as well. It is also important to keep in mind that there are alternative therapies that are available to families. These may include animal therapy, music therapy, art therapy. Sometimes some dietary control may be recommended as well. However, these are not standardized forms of treatment and are not necessarily recommended by associations across the world. So, to conclude, I think it's very important that we seek help for children with autism at an early stage so that we can intervene and provide them with the right kind of support that helps them engage in a meaningful relationship with their family and the surroundings. Thank you.